Good morning, guys. Tony Maritato here, licensed physical therapist, and I'm in the clinic today talking about low back pain or hip pain associated with total knee replacement. So it's really common that after you have your knee replaced, the structure of the leg, the hip, the ankle, the knee is in a completely different position than it had been 10, 15, 20 years prior to the knee replacement. So it's not unusual that you're going to develop some hip pain, whether we're talking the ITBand, the greater troch or hip bursitis, or even pain at the gluteus medius. You know, this muscle right here, right above the back pocket, that's the gluteus medius area. All of those areas become sensitive. One, you're more active than you were doing physical therapy, doing your exercises. Two, the alignment of the whole lower extremity is completely different and your body has to adapt to that. So one of my favorite self-massage strategies for all of that soft tissue, all of the muscle soreness, the fascia, the connective tissue, is to simply do a self-massage using a basketball, a soccer ball. Yes, you can go down into the size of a tennis ball or a lacrosse ball, but what I find is that some of those start to become too point specific. And if that area is too sensitive, it just hurts too much and patients don't want to do it. So it's nice to start with kind of a big broad surface like a basketball. And all I'm going to do is I'm going to put it behind my body between the wall and the back of my hip. Now, if you have a condition like lumbar stenosis or if you have a history of low back pain, this is a great solution for that as well. But basically what I'm doing is I've got it kind of right on my belt line to start. I'm gonna roll side to side. I'm gonna do the involved side and the uninvolved side just to get a sense for what everything feels like. I can go horizontal up and down, horizontal side to side. I can go up and down. Then I'll move it more toward that gluteus medius area. And if you wanna look up that term, you'll see a picture of the muscle. But now I'm working more kind of right over the top of the back pocket. If somebody's experiencing some sciatic-like symptoms or a piriformis syndrome, you can go even lower. So I'm right on or below the back pocket. I'm just applying a gentle pressure. The other nice thing about an exercise like this is it gets you moving. So if you think of my hip, my knee, my ankle, everything is moving kind of rotationally. If I go up and down, I'm getting like a mini squat. So I'm activating some of the musculature that was involved in the surgery. If I have pain in the hip bursa, which is a really common place, sometimes it's before surgery you have bursitis that persists after. Getting the ball on the side of the hip is a great way to do it. So I'm working side to side. Some sensitivity and discomfort in this area is pretty normal. You don't have to push to the point of pain, but the point of discomfort is a reasonable expectation. As I roll down, I can start to attack the ITBand a little bit. All I'm doing is desensitizing the area. I'm not applying even probably 10 to 15 pounds of pressure through the ball. So I'm not really doing anything to affect the tissue on a mechanical level, but I'm stimulating some of the touch receptors, the nerve endings. There's something called the gate theory, where if I bump my elbow, the first thing I do is I rub it because the rubbing sensation kind of confuses the information that would have been perceived as pain. So you can really work any of the areas. I've got other videos showing you how to do similar with the rolling pin. This is just another way to do it. And usually people will have a basketball, a soccer ball, a volleyball somewhere around the house. If you do, this is a great opportunity to get it out and just kind of do a little self-massage. I'll catch you on the next video.